Katrina, thanks for coming, and it's all yours.
Thank you. Hello everyone. Welcome back from lunch. As Greg said, my name is Katrina Brittain. I'm one of the senior dietitians at Mackay Base Hospital. I thought I'd give you a little background about myself. I've been a dietitian for the last 9 years. I've worked at quite a number of public and private hospitals in Queensland. And one of my favourite areas to work in is a surgical caseload. And that's because I really enjoy supporting people after they've had really big life-changing events, something like a major surgery to their bowel. It's really important. I really enjoy the work because I think I've got a really important role in helping people stay well, be healthy and enjoy life after having surgery like a stoma formation. So today I thought I'd talk to you all about a little bit about stoma nutrition and in particular nutrition for an ileostomy, because there's a little bit more involved in that than something like nutrition with a colostomy. So I thought I'd go through a little bit today about how food is digested. So after chewing and swallowing, food enters the stomach and then it undergoes further mechanical digestion and breakdown. The food then moves into the duodenum, which is the next part of the digestive system, and it's the shortest part of the small bowel, about 25 to 30 centimetres. And then food's then pushed along into the jejunum, where more nutrients are absorbed through little finger-like projections called villi. So the jejunum's about 150 to 250 centimetres long. Everyone's a little bit different, and there are millions and millions of these little villi that increase the surface area of our bowel for nutrients to be absorbed. So the next stage is food passing along into the ileum, which is the final part of the small intestine, and it's also the longest part, about 200 to 350 centimetres. So all of this time, the digestive tract is busy absorbing nutrients, and then from there, food then moves into the large intestine, where the primary role really is for water, sodium, potassium, and some vitamins like vitamin K are absorbed prior to stools exiting the body. So that's a really brief snapshot. It's a pretty complicated little system though. So as you all know, there's quite a number of different types of stomas. And an ostomy or a stoma is a surgically made connection between the bowel wall and the abdominal wall. And quite often it's done because there's a bit of disease in the bowel or the bowel's not working like it normally should. In some cases, stomas are temporary, but for some people, they're permanent. And as one of the primary functions of the large bowel is to absorb water and salt, once we have an ileostomy, the colon's then bypassed. So as a general rule, we tend to get a lot of fluid output, and that's because the body's then got to adapt to no longer being able to absorb fluid the normal way. Generally, the higher up the stoma in the small bowel, so basically the less amount of bowel that's remaining, the more difficult it is for us to manage that fluid and sometimes other nutrients. So for many people in the weeks following their stoma surgery, in particular ileostomies or higher, their stoma output can be quite high, so sometimes up to about 2 litres or even more a day, and it's really quite runny and fluid-like. Over time, the body does learn to adapt though, and so our stoma output starts to eventually weaken. And this can take for some people weeks or even months in some cases. And we have to put some strategies in place, and often medications are really helpful in this time too. Eventually though, for an ileostomy, an output of around sort of 500 to up to a litre per day is quite normal. So there are a few aims to the dietary management of stomas. We want to first of all prevent dehydration and electrolyte imbalances. And we also want to avoid what we call macronutrient malabsorption. So those are your things like proteins, carbohydrates and fats. We want to prevent people from losing weight without trying to, and therefore their muscle stores. So we want to prevent malnutrition. We want to make sure we're correcting any micronutrient deficiencies or prevent them from developing. It's important to try and prevent stoma blockages, so complication from a stoma blockage, and some of those symptoms that make quality of life a little bit easier. So we don't want to produce too much wind, or we don't want our stoma to have a particular odour. So those are the primary dietary aims. So healthy diet includes a variety of foods from all the core food groups. You've probably all seen the food plate model. So our 5 core food groups, for anyone who didn't know, are your breads, cereals, fruits, vegetables, dairy and meats or proteins. And for people who have an ileostomy, you're encouraged to have a healthier diet just like anyone else. There is a bit of dietary recommendations post-operative to help while everything's adapting and while your stoma swelling is going down. But then long term, it's just general healthy eating advice and maybe some specific diet advice that's tailored to your personal needs. So you might have already seen this little handout that's up here on the right hand side. I know Jenny often uses it in her practice, and I find it really handy as well. So it's nice visual representation of a few foods and drinks that we can either avoid or include in our diet to help manage any particular symptoms. So we can modify the types, quantities and timing of certain foods and drinks as well to improve symptoms and quality of life. Many people, yes, as I mentioned, will have seen this handout before. And what essentially causes a symptom in one person might not happen for the next. But this is a nice little handout to refer to. So some of the strategies in this handout, or some of the foods that we've got listed up here, can help you to thicken your output, loosen output if it's too thick, reduce odour, wind, the risk of blockage. A little bit back towards fluid management and why it's so important. If you've got quite high volumes of stoma output and it's quite liquidy, it can increase your risk of becoming dehydrated. And for some people, if that's prolonged or really quite bad dehydration, you can get an acute kidney injury. So hydration is really important, and if you've got that high output, foods are also moving through the digestive tract really quickly, and your body might not get enough time to absorb some of those important nutrients. So over time, that could lead to some nutrient deficiencies. So some of those signs of dehydration include being thirsty, having really dry mouth, if you've got decreased urinary frequency, or if your urine's a really dark colour, if you get really quite dry skin, have headaches, your heartbeat can go a little bit faster, if you start to feel tired and lethargic, faint will start to have some muscle cramps. Those are all some symptoms of dehydration, so things to be mindful of. So in order to stay hydrated, it's really important for everyone to get enough fluid, in particular water, each day. So it's good to aim for about 8 cups or glasses of water, which is around about 2 litres. And most of this fluid should really be coming from water. Some people might have some fluid restrictions for other reasons, but that's a specific recommendation. If you haven't had a recommendation like that, everyone should really be trying to aim for about that 2 litres. So if your stoma output is quite high, so maybe like above 1.5 litres a day, you could be becoming a little bit dehydrated. So you might need a little bit extra fluid in this time. Also, particularly in Mackay, where it's really, really hot and you're doing lots of sweating or you're really active, we've got to replace a little bit of that extra water as well. So for some people, rehydration solutions like your hydrolyte or gastrolyte that you can get from the pharmacy, or even the supermarket can be helpful, because there's some electrolytes that help draw the fluid across the small bowel into the body. For some people, the concentration of those electrolytes aren't quite enough. We need a special type of rehydration solution drink. Sometimes having things like sports drinks are not quite enough, because the concentration of those electrolytes alone might not be enough to keep you hydrated. So if you're having higher stoma output, it's good to reach out and have a chat to Jenny or dietitian or your doctor in case you need some extra strategies. Keeping an eye on the colour of your urine can be really helpful too, because we want it to be a nice pale straw colour, not too dark and concentrated, which means we could be dehydrated. So there's some dietary strategies to help manage in ostomy in particular, that's quite a high output. So if it's starting to get over a litre a day quite consistently and it's really quite watery, we can implement a few strategies. One of those is making sure we're having foods that are thickening foods. So examples of those are things like white bread, pasta, rice, mashed potato, porridge, banana, peanut butter. I think of those as all of the stodgy types of foods. They're quite thick and gelatinous, and they move through the bowel quite slowly, and they provide that nice soft bulk. Sometimes it's useful to separate the timing of your fluids with your foods. So avoiding having any drinks before and after your meals, maybe 15-20 minutes either side, and that can help to stop the dilution of the meal so that it moves through the bowel quite slowly. Sometimes it's good to avoid some foods that tend to speed up our digestive tract. So caffeine, because it's a bit of a stimulant. Sometimes sugary drinks and artificial sweeteners can have a stimulant effect on the bowel. Alcohol's another one, and really quite rich or fatty foods and spicy foods for some people. But again, it's very individualised. For one person, a really high-fat meal wouldn't normally give them any symptoms, but for others, it might increase their output and make it quite watery. So it's really common to use some medications to help us with our stoma output management. Things like Metamucil or loperamide, which is commonly known as gastrostop, is a really helpful medication for a lot of people, and particularly in those early stages while the bowel's trying to adapt. So what do we do about food blockages? For some people it's never an issue, but it does happen from time to time for others. So it's good to just be mindful if you haven't had any output from your stoma for some time, so maybe around 6 hours, or if you're also getting some symptoms of some abdominal pain, cramping, bloating, or if you're feeling nauseous or vomiting. Do you have a question?
I know it's probably not question time yet, but I've found when I change my appliance, I can go at least 24 hours or longer before it starts getting active again. Is that anything to be worried about?
I go by some of those other symptoms as well. If that's quite normal for you, and you don't then go on to have any pain or discomfort, but you notice that your stoma does start working again, then it's probably nothing to worry about, because everyone is really different. It might depend on quite a lot of different factors like your diet, just this general speed of your bowel. For some people, it's normal to open their bowels 3-4 times a day. For others, it's every couple of days. So again, everyone's quite different. So I wouldn't say it's anything to worry about without knowing any more information. Yeah. Okay. So things you can do to avoid blockages is make sure you chew your food really well. Something that a lot of us forget to do, but it's really important. So we can start the digestive process nice and early by breaking down foods into much smaller pieces, and that gives the bowel much more opportunities to absorb nutrition, and it also breaks things down to those smaller particles, which means it's easier to pass through that plumbing system. We can limit our insoluble fibre, the insoluble fibre in our diet, and so that comes from like the structural part of the plant. So the skins on fruits and vegetables, the pith, the seeds. If you think about celery, it's really stringy and you can chew on it all day. That's like a really structural part of the plant, a high insoluble fibre. So we can just limit the quantity that we eat those sorts of foods. And that's easier for our digestive system to manage as well. As I mentioned before, in the first sort of 6 to 8 weeks after surgery, your stoma takes some time to settle down, and that's in particular a time where we might want to avoid these foods to avoid a blockage. If you do think you might have a a blockage to your bowel. It can be useful to stop eating solid foods for a short amount of time but keep your fluids up. Make sure you rest. Some people find that using a heat pack can be helpful. As long as it's not too hot, please don't burn yourself. Giving yourself a light massage around the area of your stoma and your abdomen can be useful too. And if your symptoms are persisting or getting worse, it's really important that you reach out and speak to your doctor or even consider coming into the emergency department. Okay, so where to go for help? Well, a lot of people don't get the opportunity to talk to a dietitian before they leave hospital after they've had a stoma formation. So if you happen to be under the care of a specialist at a Mackay-based hospital, you might be eligible to be seen by one of us in our outpatient clinics, so you could get a referral that way. Alternatively, there's quite a few dietitians that practice locally in Mackay that you can get a referral through your GP. Most people should be eligible for a chronic disease management plan, which makes it a little bit easier to access that service. Or you can really simply look online at Dietitians Australia and give them a call and book yourself in. You don't necessarily need a referral, but it's an option if you want one. And that's all from me. Thank you very much.
Katrina, that was great because it was plain, straightforward, simple, but stuff that a lot of we know, but we don't practice, and we need to be reminded about what we should be doing. So that's great. Thank you very much for putting that together. We really appreciate it. And we've got a little present for you, but I've got to get